beautiful sunset. I want to welcome everyone to the Lisset Community Services Dining Center. This is where we do our community dinners 5 nights a week, but we also use it with other agencies, groups, and partners who are trying to gather with the public and are looking for a warm and attractive space. So I welcome all of you here. And you have Sharon and Sheila from the Vermont Workers Center, and they have a program for you this evening. I hope you enjoy yourselves.
Howdy. Thank you all for coming out tonight. I know we've heard a lot of stories about the exchanges and all the trouble people have had, and tonight we're actually going to be talking about moving to a system that actually meets our needs, that meets everyone's needs. Today is the 10th of a series of events across the state designed to lift up stories from the clinics and to continue the conversation about how our universal healthcare system, Green Mountain Care, will work for all of us. We're going to start off tonight's meeting by watching a short slideshow. The slideshow documents health screening clinics that were held throughout the state this summer and fall to provide basic health services to our communities, but also to ask people about their unmet healthcare needs and talk about what they would like to see from our new system. So Kate is going to do the slideshow.
The 4 panelists are Adam Sorsher. Adam, if you wouldn't mind just standing up and telling us your specialty.
Oh, I'm a family doctor primarily at Dartmouth, and I also have a special kind of interest in sleep disorders, and I've been in practice for about 20 years in total. And I've got laryngitis today.
But that won't stop it. And then there's Dr. Peggy Stone, just if you wouldn't mind, so that people know who to direct a question to. That's why I'm introducing you.
So I'm Dr. Peggy Stone, and I'm a dentist in Woodstock, Vermont. And I'm a general dentist, and I've been practicing dentistry for 25 years, and in Vermont for 23 of those 25 years.
And Robert Spotswood?
I'm Robert Spotswood, and I run North Star Counseling in Norwich, Vermont. And before living in the Upper Valley, we lived for 4 years in Canada. So I'm very motivated to be here and help out.
If you couldn't hear Robert, his practice is called North Star Counseling. And then we've got Michael Costa from the state. And Michael, would you mind standing up, please? Thank
Good
you.
evening. I'm Michael Costa. I serve as Deputy Director of Healthcare Reform for the state of Vermont. I'm also a proud resident of White River Junction.
Hey, woohoo! Join our OC. And this is the Vermont Worker Center Windsor County Organizing Committee. And you are going to, if you have a question about healthcare and you want to specifically address one of the panelists, please write your questions and we'll collect them later. And we are here tonight because we're in the process of talking about healthcare reform in the state of Vermont and of course across the country. And what kinds of decisions are ahead of us, and there are quite a few. We're talking about financing now. And so I know people have a lot of questions and want to hear what everybody has to say. And at the end of the evening, we will also be asking you how you would like to get involved, so think about that as well. I got involved with the Healthcare as a Human Right campaign around 2008, and I met Kate for the very first time in Peacham, Vermont, where Bernie Sanders was speaking, and there was an overflow crowd of about 500 people there. And it was at the Friends Meeting House, and there were people on every level, in every seat, and outside the building. That's how many people came to hear about healthcare. That's how important it is to all of us. And I've been involved ever since, and Kate is a master at getting people involved, so she did with me, and now I am a member of this organizing committee. Healthcare is at the top of everybody's list, but we also are involved with other things that have to do with healthcare and just justice and dignity in your health and in your work. And so we base everything on 5 principles: universality, equity, accountability, transparency, and participation. And right now, we ask ourselves, and is this system of healthcare, does this system of healthcare meet any of these principles? It is not universal, because so many people are left out and they can't get the care that they need, such as dental and vision care. It's not equitable, because those of us with little money have greater difficulties getting that care that we need. It's not accountable to anyone, because we can't hold insurance companies responsible for ensuring access to care. It's not transparent, because we don't know how important decisions get made about our health. And it's not participatory, because we're not making any of the decisions. Everyone that's involved in designing our healthcare system should be guided by these human rights principles. We really believe very strongly about that, and that these are the standards by which all these decisions should be made. And our experiences in the healthcare crisis demonstrate why it's so important that the law we passed, Act 48, recognizes these principles. Our healthcare system has one primary purpose, to ensure that the people of Vermont can be as healthy as possible. And to achieve this, we must change the system that we have right now in 2 key ways. The focus should be on care, not on coverage, and that we should provide health care as a public good and finance it equitably. These 2 questions should focus our conversation tonight and in the future. Care, not coverage, and equitable financing. Those 2 things, very important. Right now, we know we're in a transitional period, and as required by the Affordable Care Act, that we have a process of creating a healthcare exchange system, and Vermont residents can purchase healthcare. And they may also be eligible for financial assistance. But while this new law has consumer protections, it is just designed to push more people into the insurance system and owning insurance instead of getting the care that they need. This is just another way to do the same thing, deliver health care as a commodity and not as a right. Tonight we focus on the conversation on getting universal care and not on the exchanges. I am going to now, I'm going to show a little video, and then I'm going to hand the mic over to Sajid. We'll watch the video first.
2011 was a historic year for the growing human rights movement in the United States. After many years of grassroots organizing by the Healthcare is a Human Right campaign, Vermont became the first state in the country to enact a law for a universal, publicly financed healthcare system based on human rights principles. This was a huge breakthrough and can be seen as a model for how to use grassroots power to demand our human rights. In 2008, the Vermont Workers' Center launched the Healthcare is a Human Right campaign as a radical new response to the ongoing healthcare crisis in Vermont. It began with one-on-one conversations and surveys of Vermonters across the state about their healthcare needs. Out of these conversations, it was clear that thousands of people were needlessly suffering and dying because Vermonters were denied their human right to healthcare.
My name is Michael Markoff. I've been without health insurance for 20 years.
I do not want to have to justify to insurance companies that I want better quality of life and have to tell them or have them tell me it's too expensive.
I've gone for an MRI, which I debated on for so long, and have the bill for that and the bill for this and that and a whole bunch of other things sitting on my kitchen table at home.
What I find so frustrating about my job is that probably at least 50% of the patients that I take care of never should have ended up in the ICU.
I can't afford treatment if it is serious. If I go and find out that this is cancer, I've essentially bankrupted my family. On the other hand, if I don't go get treatment and it's cancer, I've left them without a debt.
As a self-employed carpenter struggling to make ends meet for many years, I had to choose between being homeless or having health insurance.
I just can't afford them. You do the math, and the money's just not there.
It's hard enough emotionally, physically, living with pain every day, without having to worry about how I'm going to get out of debt.
I am not a price tag. I am not, the value of my life is not a tax burden.
They come in for infections that they notice possibly a week or two before, but delay care because they already have overwhelming medical bills.
I do not want to have to choose between buying medicine and buying groceries.
I've seen people with diabetes, even well-managed diabetes, that ignore small ulcers on their feet that are easily treatable, but they can't get treatment for because they don't have insurance, and they end up losing their foot, sometimes their entire leg.
Tens of thousands of people are suffering, dying, and living in fear needlessly every year.
I'm here because this is my reality. This is what I deal with, and I'm here for everyone else who's dealing with it too.
The campaign is centered around 5 key principles, which give us a clear framework to guide our campaign. They are universality, equity, accountability, transparency, and participation.
Everybody must be covered, nobody left out.
Healthcare resources and services must be distributed according to people's needs, as opposed to payment, privilege, or any other factor.
There must be means of holding government accountable for failing to meet human rights standards.
Government must be open with regard to information and decision-making processes.
that governments engage people and support their participation in decisions about how their human rights are to be ensured.
A healthcare system that satisfies these principles is the responsibility of government to ensure.
At the start of the 2010 legislative session, campaign members packed the State House and delivered thousands of postcards to legislators signed by Vermonters demanding their human right to health care. By the end of the 2010 legislative session, the campaign was mobilizing for the passage of Act 128. This act required Vermont to develop models for a new system that would make healthcare a public good based on the 5 central human rights principles. On May 1st, 2010, over 1,000 Vermonters converged at the State House to call for the passage of Act 128, and a few weeks later, the act was passed and signed into law. At the beginning of the 2011 legislative session, campaign members turned out in full force again with thousands of petitions and ready to continue the fight for a universal health care bill. In May of 2011, Act 48 was finally passed and signed into law, which made Vermont the first state in the nation to commit to creating a universal and publicly financed healthcare system. In this moment, it was clear that the Healthcare is a Human Right campaign had been able to change what was considered politically possible through organizing thousands of people to demand their rights. The Healthcare is a Human Right campaign has created a new model for building grassroots power to achieve fundamental policy change. The healthcare struggle is far from over, and insurance companies are constantly trying to derail the path towards universal healthcare. Important decisions still need to be made. Will the new healthcare system really be financed in an equitable way? Will Vermonters really all get access to all the services needed to stay healthy? Insurance companies and big business employers are working hard to prevent universal healthcare from ever happening through astroturf groups and scare tactics. But Vermonters are ready to continue fighting. Join us in our fight for a universal and equitably financed healthcare system and for a government that puts people and the planet first.
So, we're just going to ask a few questions, and if you answer yes to any of the questions, could you please raise your hand? Have you ever put off getting medical care because you are worried about the cost, or do you know someone who has? If you have had insurance, have you ever struggled with high premiums or co-pays or deductibles, or do you know someone who has? Have you ever struggled to access dental care, or do you know someone else who has? Have you seen people around you struggle to access mental health care? Raise your hand. Have you ever struggled to access vision or hearing care, or do you know someone else who has? Have affording long-term care either been an issue, or are you worried about it becoming an issue for you or your family? Have you ever had to go to work sick, send a kid to school sick, or risk your job because you didn't have paid sick days? Have other factors like housing and access to healthy food affected your health?
Hey everybody, I'm Alicia. I have a paid sick day story to share with you. I for one, I support paid sick days. Yay! As a working student, mommy to 5, I often find myself stretched out in like 6 different directions, even though I only have 4 lungs, but we won't go there. One of which is a sick child. At times I feel like it's pointless for me to even hold a job. I often ask myself, what is the point of me being employed? I'm just going to get fired anyways because I'm missing days when my kids are sick. It seems impossible to be able to work and pay for childcare, and on top of that, I gotta forget about it if one of the kids get sick. At that point, I have to face the decision, am I going to go to work, send the kids to school sick and infect the rest of the community, or do I stay home and take care of my child that needs me because she's sick? And I mean, that's not including if I get sick. But when I'm faced with this decision, I could pay for a babysitter and the daycare fees that I already pay, at which point working would be moot. But at that point, let me back up. At that point, I need to decide to stay home, take care of them. I'll lose my job, or possibly not. But in my world, it would be a miracle if I didn't have to make those decisions. If I could say, okay, I gotta stay home, and I call my employer and I say, I'm really sorry, but my child is very sick. And instead of me coming in and making my coworkers sick and the residents that we work with sick, and sending my child to school sick and making all of her fellow students sick, I'm going to stay home, and I don't have to worry about the backlash of staying home with my child. And having those paid sick days would improve the health of my coworkers, clients, my children, but on top of that, it would improve my ability to have a healthy household, sustainable income, and provide for my family.
Hi, my name is Micaiah Wright. I have a healthcare story to share. About a year ago, my mom brought me to our dentist. We had one then, and they were really nice. My dentist told my mom I was going to need braces, and I have been looking forward ever since to get them. Only when my sister and brother's appointment came up a week later, my mom forgot about theirs. After all, she had just brought me and my sister Isis to the dentist. My dentist let my family go from their practice. They said we missed too many appointments just from that one day. Now every time I ask my mom, when will I get my braces, she says, I don't know. She also tells me there are not a lot of dentists that like to take our kind of insurance. All I know is I wish I could get my braces so my teeth could be straight and not hurt anymore.
Thank you, Micaiah. Thank you both. You're both awesome. We're actually going to be talking about healthcare policy and our policy at the Workers Center. So first I want to start with the fact that health insurance is not health care. Health care is based on human needs and our needs to be healthy. Insurance is a business based on selling products that will generate the highest profit, regardless of what our communities actually need. No matter how many benefits are listed in your plan, the concept of insurance coverage is still based on generating profits and not on meeting our health needs. We must shift this paradigm from coverage to care. We're moving into a new era where we are building a healthcare system based on our health needs and not profits. Therefore, we must abandon the relics of the system that does not work for our communities. That means that we cannot simply publicly finance a benefits package or insurance coverage. Rather, we need to develop a delivery system that is principle-based, like the principles we saw in the video, and designed to meet our community's health needs. In other words, currently you go to your provider in order to receive care, and your insurance company either approves or denies your provider's recommended care. That's ridiculous. This doesn't make sense. In our new system, in order to realize our right to health, we'll be able to go to our provider and receive the services we need based on collaboration between patient and provider, not an arbitrary list determined by someone looking to maximize profits. A universal system that puts people's health first must use our public resources in a way that does the most good for the health of all the people of Vermont. Everyone needs health care. That means everyone should get the care they need for all their body parts throughout their entire life. The current system is based on betting we don't get sick or injured and need to access care, and as a result, we often do not receive services until the worst is upon us. This is costly, inhumane, and inefficient. If we begin, as we must, to set policy, understanding that we need health care like food and air, and we will proactively provide care for a lifetime of health, thus respecting our humanity and curbing costs. Let's work together to figure out how to build a care system that allows us all to access the care that we need, rather than continuing to use a coverage model based on betting against illness and injury. If we provide care, not coverage, we will be healthier, and the system, as in every other country, will cost us less. But of course, we're going to need to figure out together how we're going to pay for this sort of care. Another component to ensuring that we all have access to the care we need is making it freely accessible without cost barriers for individuals. This means things like user fees, such as copays and deductibles, harm our health. I know there's been times in my life where I have not been able to pay copays and I've delayed going to see a doctor. They discourage us from seeking necessary care and filling prescriptions, causing us to become sicker. User fees shift the financial burden onto sick people, rather than spreading the cost among all of us. The principle of equity requires that the cost of financing the system is shared fairly. This means that richer people and more profitable companies pay proportionally more into the healthcare system than poorer people do. Public financing through progressive taxation ensures that contributions are made based on our ability to pay, not our needs. These necessary changes require us to think very differently. The old ways of doing things no longer work for us. A universal, publicly financed healthcare system cannot be built with the tools of the private insurance market system. To put people's health first, we have to come together and agree to pay taxes to share the cost of providing universal care as a public good and a human right. No more insurance benefit packages, no more premiums and copays for getting care. Yes to universal care based on our community's needs, and yes to equitable financing.
We'll start with question number 1. And we'll go, I'll go to Robert, and then if you don't mind, Adam. How would a system that provides care, not coverage, look like to you?
Thank you. I have the advantage of having lived in Canada for 4 years, and that system is set up for care. People all had the same card, rich, poor, young and old. When you needed to go to the doctor, you didn't ask, can I afford it? When your child had an earache, you didn't say, what's this going to cost me? Just take them in. And it wasn't even an issue. In fact, when we moved there in '91, we started getting something called the baby bonus. I don't know if you've heard of it, but it was something Canada did for all parents. When you had a child under 18, you got a check for $30 every month, called the baby bonus. And it was just to help you out. You know, it wasn't that much. The thought of using our taxes to support parents was very touching. The conservative government came in and wiped that out, but it was something that I can say we experienced. So a system that emphasizes care instead of coverage isn't looking at money. It's looking at what health care we need and providing it. Coverage has to do with focusing on how much it costs and how can we reduce those costs. So when I worked at the mental health clinic in Canada, people walked in as needed. When I worked in the mental health clinic here, copays were a very big issue. And now that I'm in private practice, I see a few people even drop out when the deductible hits in January. Adam?
Hi everyone. I want to first say how happy I am to be here tonight. I kind of got involved in the healthcare reform in Vermont, mostly through physicians groups like the Vermonters for Healthcare and the Physicians for National Health Plan. But at many of the different events that I've attended, it was always nice to see this great turnout from the Vermont Workers Center, kind of everybody working together and kind of building a coalition of sorts. So I'm happy to be part of this tonight. And I'll try not to duplicate some of the things that Robert just said. I guess for me, I want to point out that even though the healthcare system in the United States spends vastly more money per capita than other industrialized countries, presently our system really does not perform very well. In reviews by the United Nations and several other highly credible groups, we tend to rank near the bottom of industrialized countries in public health measures. It's true that there are some aspects of our healthcare system that perform well, but that's just for
very high-tech medicine in general that involves small numbers of people. But when you look at public health in general, our system does not really achieve much for the money that we put into it. And I think a lot of this has to do with the fact that it is healthcare is treated as a commodity and a business by both hospital systems and also private insurance. And the very reason that I got involved in this has to do with this sort of a resentment for what I see as profiteering by private health insurance. So if I wanted to add one thing to what Robert said, I would say that a system that provides care rather than just coverage per se would probably boot out private insurance and that sort of profit motive in our healthcare system. I think we would save hundreds of billions of dollars in doing so that could be applied to actually caring for people. That's my chief hope in healthcare reform.
Okay, so what I see as a healthcare system that focuses on care and not coverage, being one of the very important parts of the body that has been left out in our current model of coverage, insurance that is. It's unbelievable for me to see the chronic systemic disease coming into my practice and the practice of my peers, when we could be helping these patients with the inflammation that's in their mouth. But they can't seek our care because they have no coverage for the care. And we see their health declining. Just to share one little anecdote, patient of mine, severe gum disease, which is one of the #1 chronic inflammatory diseases that we Americans have. And he had artificial joints. And he ended up with a full-blown, life-threatening emergency, had to be rushed down to UMass, I think. Almost lost his life. And it was because he had dental infection, and it's not recognized as coverage. So his health care, or his overall health care suffered. So what I see as a system that provides care and not coverage is absolutely honoring every part of the body, the eyes, the ears, the mouth, and down, and down, and down, and down.
So good evening. So I serve as Deputy Director of Healthcare Reform for the state of Vermont. We've had the great privilege of trying to implement Act 48, which the Workers Center and so many Vermonters worked hard to pass as America's first universal and unified healthcare system. So thank you for that. It leads to some very funny situations like today when I brought my toddler into Dartmouth-Hitchcock because the poor little guy has pneumonia. I'm standing here and he's got a little surgical mask over him and he's crying, and the person at the front desk says, well, your insurance card is different than what we have on file. And so I work at the same place, but they changed their third-party administrator. So, in the end of the day, I have great coverage. I'm very grateful for it. But we spent 25 minutes trying to straighten out, whether, we had the right insurance so they could be properly reimbursed. And so when you think about getting beyond coverage to universal care, Act 48 makes it pretty simple. Hey, are you a Vermonter? Yes. Okay, you have Green Mountain Care. There's no question about whether you're covered. There's no question about what your benefits are. There's no question about how you be treated. It has nothing to do with where you happen to work or not work. It's just, I'm a resident, and it's a public utility like the fire department, like the police department. And it's there for you, particularly when you need it, and you don't have to worry about it. So that's what we're working hard to implement, and we thank you for all your help, and particularly all your patience.
The second question is, with a new focus on care and not coverage, and healthcare as an equitably financed public good, are you committed to standing with us, all of us who want universal healthcare, to realize this goal for 2017? And I wish we didn't have to wait till 2017.
Yeah, I'm committed. It's past due. In fact, I'm on the board of our Vermont Mental Health Counselors Association and helped get them to join the Vermont Workers Center as a member organization, which I think wouldn't have happened a few years ago. So, Adam?
I'm just looking forward to the battles that are going to be occurring in the next couple of years. I think we really have we're on the right side in this issue, but I think thus far the opposition has not really jumped into the battle yet. I think of the primary opposition as the American Health Insurance Plans lobbying group, and this is going to be a big issue for them. I think they're going to pour a lot of money into the state of Vermont trying to create fear and doubt, and that's something that's pretty easy to do in something as vast as a healthcare system. You can find anywhere some people who have been let down by the healthcare system and make stories around them that can create alarm. Think of what Sarah Palin did, for instance, on the national level with her death panels concept. This had been really just a very innocuous attempt to encourage people to talk with their doctors about end-of-life planning, and it was widely supported by the Republicans. But she kind of morphed this into something called death panels and scared a lot of people that somehow government was going to make decisions about our grandparents and whether they were going to live and die. I think we're going to see a lot of this, and it's going to be very intense in the next year or two. But if we stick to the principles that are embodied in the Healthcare Reform Act, we can really know that we've got the right side of the issue and kind of look to the truth of it and take heart in that and just keep fighting.
Yeah, I'm so looking forward to a health care for our country that is not dictated by a big business, that it can put the physicians and all the medical health professionals back in charge of the care of the citizens. I do believe that will become more affordable by getting that middleman out for sure, and that I look forward to quality still remaining high, which I think we need to set that as a goal, but cost becoming lower, and I know that can exist, absolutely. And just what Adam was saying is I think we really need to stay focused on that, because all the stories and the myths will come, the fears will come out, and those of us who are really wanting to see this realized just need to be in our center and know that that is the way to go.
You know, absolutely. The administration is completely committed to moving to Green Mountain Care, a universal health care system, and doing it as quickly as possible. It's not possible before 2017 because of the way the waiver we need from the federal government works. We're also committed to having a finance plan before the legislature in January of 2015. You may have heard in the news lately that we put off putting options before the legislature this spring. I think it's fair to say after Vermont Health Connect, everybody's concerned about doing it right as opposed to doing it fast. But my job, which the only job I have, is to come up with that finance plan. There's been no change in my job description. That plan needs to be before the legislature next January. And at that point, I think you're absolutely right. Folks are going to show up. They're going to have a very different story to tell than the one we've been telling inside of this room and other rooms like it. And it'll become very interesting, very fast. But we are on the right side, which makes it, I'd much rather have all of our arguments and trying to get people cared for than have the arguments of our opponents.
Well, I'm always reminded of how surprised I was in the 70s. If some of you remember the Equal Rights Amendment for Women was finally ran out of time and was defeated. there was a little brief note in the newspaper showing a celebration party by the opponents. And the two major opponents that were celebrating in that article were the conservative religions, patriarchs, and the insurance companies. What? So the lesson there, as in Watergate, is follow the money. And I think one of the obstacles that we have to overcome is not knowing where the money is flowing from, and we can pay attention to that. The other obstacle is feeling alone, afraid, and getting together with people like this, staying organized and connected is the antidote to that.
Well, you know, I would agree. Some of the obstacles are very obvious. There are folks who, if you're going to change the system, you know, there are folks with interest in the current system who aren't going to like it. And so being really focused on the facts and what it means for Vermonters is going to be difficult. And then I think the other thing that's going to be an obstacle is just being persistent and being patient. You know, it's early 2014. We're talking about trying to create change and momentum all the way through 2017 and beyond. And I think that just requires a lot of dedication and perseverance. Nobody in this room needs that lesson, but there are a lot of other folks who still haven't really thought, you know, what does this mean for me? What does this mean for my family? And so getting folks involved and then getting them persistently involved is going to be a big challenge over the next couple of years.
So in addition to the other obstacles that we've already spoken of, I think one of the obstacles in our way is that we need to get out there is further education on the importance of care versus coverage and how important every human being is, that it's everyone's right, no matter what, and that every part of your body needs care, and I think it's education too. So, you know, sort of even just spreading the word with all of your individual stories and all, and just getting out how important it is to have that care.
I guess I'm going to just momentarily regard this as a sort of a trick answer or a trick question or something. Obstacles, I suppose you could say that amongst the citizens in Vermont, there will be an attempt to emphasize a sort of a fear of the unknown. People who have insurance already will say, well, this works fairly well for me, and if there are massive reform, am I going to lose the coverage that I have, or the health insurance that at least works to some degree for me? But I would say that in response to that, every other industrialized country in the world offers universal health insurance at a cheaper cost and with better results. And what we need to emphasize is that we're not doing something that is unproven or untested. There are lots of examples to point to that I believe work better on whole for the vast majority of people than the system that we have presently. And so we need to keep, that's one of many points that we need to keep coming back to.
So, thank you panelists for your wonderful thoughts on this matter. I wanted to just ask Sajin to involve you, engage you a little bit more. She's going to just ask you some of the questions, some questions like she asked before.
Raise your hand if you believe healthcare is important to every person. Raise your hand if you believe healthcare is a human right. Raise your hand if you believe that we should have equity and paying for healthcare. People who make the most should pay the most, and people who are struggling should pay less. Raise your hand if you support paid sick days for all. Thank you.
Thanks, Sajin. The state have a plan for insurance that covers what is not covered by Medicare.
So, let me make sure I understand the question. So, there's Act 48, which is going to create Green Mountain Care, right? So that's okay. So the question was, does the state have a plan to cover what's not covered by Medicare? I understand that question to mean in the following way. So Medicare is going to exist whether we go to a universal system or not, right? It's going to be, people are paid into Medicare. When they're 65 years old, they're going to get Medicare, and they're going to retain Medicare. The big question is whether the benefits package for Green Mountain Care offers additional benefits beyond what Medicare offers. And if it does, then any Vermonter who has Medicare would have both Medicare and Green Mountain Care and would receive all the benefits of Medicare and then any additional benefits in Green Mountain Care. So what we're doing right now is still running various scenarios to try to determine what the final benefit package will be. One of the first things we do in these scenarios is to compare it to Medicare and then say, okay, what would this mean for Vermont seniors? And then of course there are non-seniors who are also on Medicare. So the simple answer is maybe, like everything. But you know, if you look at the financing report we put out in January of 2013, it did envision that their Green Mountain Care would offer some benefits to Medicare recipients in addition to what they have now. I hope that helps.
What effect will single payer have on town and school budgets and property taxes?
That's a great question. You know, right now when towns, they're like any other employer, they're paying for health care. It's very expensive. It goes up every year. It tends to grow faster than local tax collection. So it puts pressure on the tax base. Our sort of initial back-of-the-envelope calculation is that a quarter or more of your property tax bill is health care. So we think that if we were able to put Green Mountain Care into practice and have it be publicly financed like it's supposed to be under the current law, that would help reduce the pressure on everybody's property tax bills. And it's one of the, really, as a guy who spends his whole life thinking about taxes, that's how exciting my life is. You know, that's one of the most exciting things that we could do, is to try to offer better care and better outcomes for less money, and you know, be paying that and getting that value back to taxpayers.
I hope that answered the question. There's another question for anyone on the panel, but this one might actually be for us. What does single payer mean? And I think what we're talking about here is universal health care. Single payer is a method of paying for the care, and that would come ultimately from the state. And so I think single payer is how you pay for it through the state. But we're talking mostly about universal health care, and there is a distinction. Anybody in my group want to?
I guess I also think of single payer as implying also the publicly funded aspect of healthcare. In other words, rather than having literally hundreds and thousands of different health insurance policies, all with their paperwork and their complicated enrollment and eligibility kind of rules, you simplify things and make it publicly funded and largely have a public entity like the state of Vermont be the source that is paying for healthcare bills. Implied in that is that it's a more accountable system, because if a consumer then is dissatisfied, they have theoretically the ability to appeal that to an accountable official, an elected official, which you don't really get in the current state of affairs. If you have a gripe with your health insurance company, it's more like tough luck. So I think that single payer, I mean, I think these things are not necessarily that simple, but by and large, to me, the appealing concept is to sort of simplify and have a publicly accountable entity that is paying for medical coverage for citizens.
Will our personal health information be leaving my Vermont provider's office and go to any state agency?
I think one of the best answers to a question is I don't know. It is hard for me to envision how it would, right? It's hard for me to envision how that would occur, you know, but at the same time we haven't determined how the system's going to be administered, and that's something that we're going to, you know, be drilling down on and work towards an answer on in the next 12 to 24 months. But you know, right now there's no plan to, you know, have your doctor's office connected to a state agency in any way and then sharing your personal health care information. So I'm happy to, you know, think more about that, but that's not something that I'm aware of right now. I don't know if somebody else wants to take a crack at that.
There's a few more questions. Sorry,
I just sort of want to make a side comment on that. So currently, the insurance companies have a lot of that information. And I have personally received, you know, just unsolicited, a letter from the insurance company that says, hey, I noticed you haven't refilled this prescription yet, and, you know, are you still taking it? And we think you should still be taking it. And it's something that my doctor and I decided I discontinue. And there's this random middleman telling me, take more medicine, you know? So it's just, you know, I'm just throwing that out there that it already exists. It'd be nice if we could make it so it doesn't, but it already exists with insurance companies.
This person is asking, how is the state of Vermont going to help my 87-year-old mother who needs some small amount of help from time to time, feel like she is not going to lose her Medicare due to the fact that I live with her to help her?
So, yeah, I think that's a good question. I think this goes back to what one of our fellow panelists said. There are people out there who are going to try to scare you about change. And I think every time I go out and speak publicly about Green Mountain Care, people say, you know, I'm really nervous about what you're going to do to my Medicare. And my answer is always, we're not doing anything to your Medicare. It's going to be exactly the same. We're not taking it, we're not doing anything. It would require an act of Congress to have Vermont administer Medicare. And I don't know if you've noticed, but Congress hasn't been real productive the last 10 years or so. And so we're not going to be doing anything to it. It won't change. And people shouldn't be worried. I would expect people to try to scare folks on Medicare pretty consistently between now and 2017. But don't let them fool you. The other thing I say is, you know, we'll do our best to keep the government out of your Medicare, which of course is a joke. It's the most popular healthcare program in the United States. It was fully, it's a fully federal program.
That was my question, and I wanted to, I didn't probably say it right, but I live with her, and because I make over an amount of money that she has to require to report to the state, she's at a place where she could lose her benefits because I make too much money to live with her and help her. Does that make sense?
Yeah, so so she's a Medicare, Medicaid dual eligible person?
Yes, I
Okay. Yeah, and so she probably qualifies for something within what's called SLIMB or QUIMBY, one of the programs to help dually eligible Medicare and Medicaid recipients with their premiums and out-of-pockets, yeah. To the extent there's a benefits cliff now, I'm not certain that Green Mountain Care would help ameliorate that, but it certainly wouldn't make it worse. You know, it may, depending on the benefits package of Green Mountain Care, it might help, but you know, I'm not entirely certain. But we wouldn't be going out and trying to wholly refashion how that would work. Medicare and Medicaid dual eligibles is a really complicated area. So thanks for that question. And I'm happy to talk afterwards if you have other specific concerns.
For anybody there who is confused about the term single payer, let me point out that Medicare is our example in this country of single payer health care. It's a government program. The problem is it's only for people over 65. It's extremely popular. It's very relatively to the rest of the healthcare system, I believe it's incredibly well run and has very good effectiveness in the care that it provides. So that's something to think about as a model. The idea is, can we just extend that to everybody else?
Michael, what happens to Vermont residents whose family doctor is in New Hampshire? Could we have a little
Yeah, and I'm on the border, and my primary care doc is at Dartmouth Hitchcock. Same with my spouse. Same with my son. The short answer is that the intent would be that nothing would happen. You'd be a Vermont resident. You'd receive Green Mountain Care because you're a Vermont resident. The state of Vermont, through Green Mountain Care, is going to have to contract with a network of physicians. There's a pretty good assumption if you're a Vermonter who receives care from a New Hampshire doc now, you'll very likely be able to continue that. We are really cognizant of the fact that we're a state with borders and people that go back and forth, both getting care in multiple states or working in one state and receiving insurance from an entity in another state. And so in all of our planning, we think a lot about how we interact with our providers in New York and Massachusetts and New Hampshire. And we feel pretty good that we're going to be able to maintain the same types of relationships.
This is the final question. It's for all of you. I don't know who would like to start. What are some of the milestones we need to be prepared for? Sort of supporting, rallying for, expecting on our way to 2017, I guess.
Sure, I'm happy to take that. Just the way I think of it, I really think of it as, you guys helped pass Act 48, and now we're trying to implement Green Mountain Care, which was what Act 48 created. The rubber's really going to start to hit the road in early 2015 because we're going to introduce a finance package to the legislature. It's been really interesting for me to come over to healthcare where people get excited. Typically, when you're in a tax committee, things are less exciting, but it's very, very difficult. So, you're going to put a $2 billion finance plan out there. I mean, things are going to get really interesting. We're going to need everybody's support. At the same time, we'd anticipate sometime around early 2015 introducing the benefits package that goes into Green Mountain Care. That will go to the Green Mountain Care Board, and that will be a really important milestone. So I think that those two things together are really going to be big picture things that your members are going to care deeply about. And the governor's proposal is really going to be the beginning of a statewide dialogue on these things. Right? As much as it would be nice if people said, yeah, that's a great idea, let's do that, typically there's a lot more discussion. So we anticipate 2015 being the start of a really big conversation that probably looks more familiar to you based on what you saw in 2010 and 2011 versus the last couple of years where we've been implementing the ACA, which is kind of our, kind of funny off-ramp and on-ramp back to single payer, and kind of waiting to see what happens. I think the action will really pick up with those two things in 2015.
I want to add that the milestones that I anticipate are overcoming obstacles as they come up, whether it's lawsuits or lobbyists. For instance, the paid sick days, I think this coming week is very critical because it's floundering. And so there's a big move on by the Workers' Center to get that bill moving again. And I think those are the kinds of milestones I anticipate that may not make the news, but will make it or break it.
Okay, guys, we need to get prepared. And ramp up and get people excited about this and get people involved because we need to do this together. We're going to close with Griffin and a call to action.
Thank you so much for everyone's coming and everyone's participation. I hope you're leaving today with a better understanding of the way we're going to be moving towards care, away from this idea of coverage and towards a model that really takes care of our needs. We heard a little bit about the opposition we're going to be facing. We're going to really need to be ramping up our organization, our efforts in 2015 to face some of this big opposition. We're facing big challenges by the insurance companies, but we also have a responsibility coming here today to take charge and be organized, because it's not just, because what we're facing is a model that profits on our health. We can't be in a place where people have to wait for their parents to get the right job in order to get glasses, right? We can't, I've scrounged for money to take the bus before. I don't want to be scrounging away to pay co-pays. We need to be in a system that really works for everyone, that works for care. And that's why I thank you all for coming tonight, and thank you so much for being a part of this movement for care, for health care, because it's a human right, and we really, really need it. And I'm going to let Sheila finish the off.
Hello, everybody. Thank you. I'm Sheila, and thank you all for being here. So how many of you want healthcare as a human right? I want to hear you. How many want healthcare as a human right? Say yes. Say yes. When do we want it? Now. Healthcare is a human right. When do we want it? Now. So I want to say thank you to the panel. First of all, I want to thank all of you. You were absolutely great. Thank you for answering all of our tough questions and all the audience questions. And I want to particularly thank you, Michael, and ask you, is this enough? Is this enough? Are you going to hear these stories, and are you going to bring these stories back to the governor and say, I was here today, and I heard multiple stories. I heard a testimony from, how old is she? She is 9 years old. 9 years old. You heard a testimony from a 9-year-old child that she lost her dentist. Is that story going to go back to your governor?
Of course.
Say it again.
Of course. But I guess what my boss, what the governor has said repeatedly is, this is going to be the biggest political lift in the history of Vermont. So, we have to look at each other and say, is this enough? Right? Is this enough to do that? So certainly I promise you that I'll bring those stories back, and he'll be very happy to hear them. But we need to look in the mirror and say, when the rubber hits the road over the next couple of years, is this enough? And can we do more?
Great. So you mentioned that, so what I hear is, though, this group of people and us saying our stories isn't necessarily enough. How many people think that just being here is enough to move this forward with the universal healthcare system? Raise your hands if you think being right here tonight is enough. Okay, great, because I'm going to tell you some things, a call to action of how we can get together in solidarity to make it enough and to make sure we make this a reality for us. Do people want to hear that? People want to get involved? Raise your hands. Raise your hands, you want to get involved. Okay. Okay, there's lots of ways you can get involved. You don't even have to leave your house sometimes to get involved. So I want to say first, I want to thank everybody for coming tonight. I want to thank you for all sharing your stories, your testimonies, your questions. We all know that there will be a lot of attempts at scaring people over the next few years, because there's a lot of people who are profiting from the current broken system. But we also know that no one is going to change this broken system except us. It is our responsibility, and we can't wait for the next person to do this. How many here are going to wait for the next person to make this a reality? Raise your hand. How many of you are going to be part of this reality? Raise your hand. Great, great. So but we know that this is going to be hard. So we need to build enough power to create a system where everybody gets what they need when they need it. That's key, right? So like currently right now, I have a healthcare situation. I can't get the healthcare that I need right now because I have an $1,100 deductible. $1,100 before my insurance kicks in just 80%. So right now, every single time I go to the doctor, I'm paying out of pocket. I'm a single parent of 2 children, work full-time. I can't afford this. I can't afford it. And not only that, but then I'm trying to afford my children's insurance too. That's just mine. It's serious. I need to access the care I need to access because I need to be healthy. I need to be healthy not only for my family, my children, my employer, but my whole community. We're in communities. And that's what's key, is that sometimes we forget how interdependent and interconnected we all are. And that at the end of the day, it isn't just about us, is it? It is about our neighbors. It is about our friends. It is about our coworkers, and it is about our community. So we want to invite you all to get involved with the Healthcare is a Human Right campaign. We are a campaign made up of everyday people who are standing up to big insurance companies, their lobbyists, and organizing for a healthcare system that puts people first. The first thing we're asking people to do, which we mentioned throughout this forum, was to please, and if we can hold some stuff up, please sign a paid sick day petition before you leave here if you haven't already. And please give us your story. Your story could be, I've worked 3 jobs all my life and I've never had a paid sick day. Why? Why? Your story could be, I was fortunate enough, privileged enough to work maybe in a union or a school system or somewhere else where I was afforded that benefit of paid sick days. And now I think it should be a right for other people too. Please don't just fill out the petition. If you can, just leave us a brief story of your experience. We also have a Healthcare is a Human Right petition. It's not over. As you saw, we still have to continue to keep moving forward to make sure that we hold our government accountable to equitably finance this system of healthcare that we're asking for. That's not going to happen by us sitting back and letting somebody else do the work. It's going to happen by us sharing our stories, organizing, and fighting for us to move this forward. We want you to also sign, we have wonderful partners over here, and I want to thank our partners, Planned Parenthood, Early Educators again. We have an Early Educator petition, and we encourage you to see Cindy over there and Tim, thank you, over there, and to sign the petition if you haven't already signed the petition for the right for early educators to organize. And if you don't understand why that's so important, how many of you used to be infants or toddlers? Raise your hand. All right.